It's 7 a.m., and Pat Nelson is starting another 12-hour shift in the intensive care unit. She knows this routine well. She's done this job for 36 years.
When did she go to bed?
She went to bed about 21:45.
Okay.
And she's a total monkey.
I know.
She was on 30 until about 10 minutes ago, and then we went down to 20.
Amanda Bush is also starting her shift. Today, she's looking after a baby named Healy, who's just had heart surgery. Amanda has been an ICU nurse for 2 years.
Your attention's focused on one family and one child for the most part. So you're able to kind of give, complete care to one child and one family, which is really nice and something I quite enjoy. So baby had a really good night, slept really well. We had her on the morphine overnight, so she was really comfortable, didn't have any pain.
There she is. Look at her. Hello, baby girl. The best part of my job are the kids. The kids are amazing. They don't have time to be sick. Kids just want to get better and go home.
Do you have good sleep? Hey? Should we do your temperature, see how you're cooking?
Yes.
For the past couple of months, Pat has been primary nurse to 2-year-old Arena. Arena has spent most of her life in the intensive care unit, far from her hometown of Penticton.
I love Arena. Yes, she just lightens my day every time I come in. Oh, she's outgoing and she's happy and she's interactive and she loves to learn and she loves to move. She rarely sits still. What did it do? And if you look at her and you go, oh my God, but she's got a tube here and she's got a tube there and she's got a ventilator. None of those things bother her, so we can't let them bother us. Hello.
The ICU holds the most critically ill children in the hospital, as well as kids like Arena, who depend on ventilators and other technology for survival. For an ICU nurse, the day routinely involves medications, diapers, and tubes. But it can also include what children need the most, playtime.
Knees and toes, knees and toes. These are the best parts of your day. These are the normal parts. This is what little kids are supposed to do. And if we can spend time doing that, then the parts which are, quote, abnormal aren't as important to them.
On the other side of the ICU, Amanda is working with other caregivers to get Healy off her ventilator and breathing on her own.
You see Mom and Dad? There's Dad.
K-L-M. Pat also helps out with Tristan, who needs a heart transplant. Tristan, like Arena, has an isolation room because he carries superbug bacteria on his skin. So Tristan has lived in the same small room for most of his life. This is his world, his home, and his playground.
Ba 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 ba. Obviously, the first challenge is space. It's a huge challenge, giving these kids all the stimulation, physical and psychological, that they need when they live in a square box with a window.
In a rare, quiet moment, Amanda cuddles with baby Healy, who is recovering quickly and will soon leave this unit.
I think the best part of my job is exactly that, just seeing the kids go from being very, very sick to being able to take them upstairs to the ward where they're at a point that they're healthy enough to be up there, or to go home.
Of course, ICU isn't all cuddling and playing. Today, Pat must give Arena her vaccinations.
Good girl. It's okay, Arena. It's okay.
But because Arena cannot make sounds, her cries are silent.
I'm done.
Oh, baby, I'm so sorry.
I know, I'm so sorry.
ICU nurses spend a lot of time comforting their patients. But nurses also have to find ways to comfort themselves when they have a rough shift, or worse, when a child loses the battle for life.
I cry a lot. Sometimes I cry on the way home. I go home when my kids were teenagers. I would go home and look sad, and they'd go, "Oh, Mom needs a hug," and I'd walk in the door, and they'd both give me a hug. That helped.
She is just on Tylenol, morphine's off.
As her 12-hour shift winds down, Amanda gives a full briefing on baby Healy's status. And Pat does the same for Arena.
Excellent. Thanks, Pat. Okay. See you tomorrow.
I definitely picked the right career for me. I can see myself nursing for the rest of my career.
I did pick the right career, and there aren't very many people who can say after 36 years like that they still love coming to work every day. And I consider myself so lucky to be able to keep doing that.